it's something that despite, being quite successful and ambitious, that there is still those same insecurities around, am I successful enough? Am I, and the imposter syndrome sort of thing. I think that you might think from afar or looking at someone that they have it all together, they know exactly what they're doing. And that, again, for many, many people, that is not the case. I've been interested in healthcare for a very long time. My parents were physicians, and I really had been fascinated by healthcare and public health since I was a kid. What was different though, is mental health and psychiatry was something that I never knew anything about. Growing up in a family of immigrants, we never talked about mental health or feelings or anything like that. And even going to medical school, I just didn't know anything about it, to be very honest. The way that I actually got to mental health was that when I was in med school, I myself was diagnosed with depression. And that was my first sort of big splash, if you will, big entry into what is mental health to begin with, is having to learn about it from the perspective of a patient. It was a very big kind of eye-opening experience of this, kind of first big diagnosis, first thing in any part of healthcare that had really ever happened to me. And what fascinated me about it was both, what it was like, from the medical perspective in terms of how it felt to have this disease, to get treatment for this disease, but more so than anything else was actually this huge social component to it, where, my brother grew up with asthma, for example. And the way that everything from how I was talking to people and sharing, oh, I have this diagnosis, through what I heard people talk about around getting help, getting treatment, and specifically pushback around getting treatment and getting help, all the barriers that were in place, everything from should I take medication or not, should I get therapy and not, that for something like asthma, it was this default. Of course, you have asthma, go get treatment. Let's support you in getting treatment, right? And certainly, if you were in school, if you were telling family or friends, it was this guaranteed, go do this, right? But for mental health, it was very different. And so that was one big thing of just recognizing, wow, why is there this huge other element to what it means to even have this disease that I thought was very fascinating. Then that's actually what made me interested in it from a doctor, the perspective of a doctor, is wanting to understand more about that. When I started to treat patients in medical school, I felt this incredible connection and this sense of really, the word I always use is sacred, that the way that we as clinicians get to talk to our patients when they're struggling with their own mental health really feels like this sacred relationship, that they're bringing so much to that relationship, often talking about things that they never have in their entire life. And it felt like something that was really special and really important. My brother, I have a brother who's a year older, his name is Neil, and he always has said to me, when thinking about your career, think about the problem that you want to solve. And what do you think the biggest problem is out there that you can solve? And so for me, when I saw mental health, and specifically both having gone through it myself, and then the more I learned about it after having gone through it and learned what it was like from a clinician perspective, I realized, wow, this is just this tremendous problem that's affecting, millions and billions of people in our world. And moreover, that it's a very interestingly interdisciplinary problem where there is this medical and clinical scientific component. And there's also this cultural and economic and political aspect. And all of that I thought was really fascinating. That's number one, what made me feel like this is something I want to take on for the life of my career, and why an MBA is going to be so tremendously beneficial in trying to help solve problems in mental health, because it is so much more than just a clinical or medical issue, that it's so interdisciplinary that needing to understand the role that business plays in everything from the business of pharmaceuticals all the way through, the business, certainly the business of healthcare, but even more than that, right? Like what are the roles that employers play in being able to offer services, and, just that whole, I think, multidisciplinary element. It felt like business can offer solutions to mental health in ways that traditional medicine cannot. And I wanted to be able to learn enough to be a part of that. The first thing I would say is that you're not alone, and rather that it's probably that the majority of people around you are feeling the exact same way. One of the most eye-opening experiences for me, actually, before I went to medical school, is in my training in residency. I worked at Stanford Student Health Center. And so my patients were the MBA students. And what I saw was that almost all of them were actually dealing with these same stressors. They were very anxious and coming in for all the same things that we're talking about today. But what was fascinating to me was that despite the fact that everyone had these same stressors, that they all thought they were alone because no one was talking about this. And they felt like they were, one of 100 or one of 300 or 500, however big that class was, that they must have been the only ones feeling like imposter syndrome, or the only ones struggling with meeting deadlines, or the only ones who had no clue what they wanted to do for their summer internship or after graduation. All these things, all these very normal insecurities or just questions, right? Questions that we all have that only them or maybe one other person was struggling, when the reality was oh no, actually everyone is struggling with this. Maybe there's that one kid who really, who does, who is okay, but truly, that, like, let's say 90% of people are probably struggling, and maybe on some level, with some spectrum of that, right? But that, again, no one talks about it. So it feels very isolating, but that it's actually a completely normal experience. I think that for it to be normalized and just to realize that, oh no, everyone else is struggling with it, that itself actually does a lot, because there's something so isolating about thinking you're the only one. It makes you feel that much worse, because it makes you think, oh, everyone else can deal with it and I can't. Therefore, is there something wrong with me? But then once you realize that, no, this is a normal party experience, and you can just accept that it's going to be stressful and that it is normal to be stressed out about these moments, because of course you're just starting off in a new program and there is a lot of content, and it's supposed to be stressful when you're learning all these new things, or when you don't know what you want to do in summer. Like, that's all okay. And when you can accept it and come to terms with it, that completely changes what the experience looks like, compared to, oh, I'm supposed to, or I should be acting in this other way. And, like, it's getting should out of your vocabulary and getting supposed to out of your vocabulary. The common stressors that I see are a lot of the things I think that we've talked about, stress around everything from imposter syndrome, certainly at not only at the very beginning of school, but all throughout. And even if we think about almost this chronological thing, right, around the MBA experience, at the beginning, it might be imposter syndrome around, should I even be here? I think there's stress then around, how do I make the most out of my experience if I'm not signing up for every class or signing up for every club or doing all the toughest classes? Am I going to somehow not live up to my potential? And then once you're in the classes, there's this kind of overwhelm between balancing class with all the other kind of extracurricular activities going on there. I think then there's the sense of, wait, there's class, but then there are all the networking opportunities and all the kind of after school events I'm supposed to be doing. If I'm not the most social person, and if I'm not going to every party, are people going to like me? Am I going to miss out on that one cool, amazing person I could have met? And maybe that would have led to me starting the next big company, or, like all of that. And it's just that sense of like FOMO, right? That like constant sense of FOMO in every interaction you take. That, we all have a sense of FOMO in general, but that gets kind of heightened. And that can be really stressful if, like, you are questioning every little thing you do. And then all the way through, did I, what do I, kind of the normal career related stressors? Do I want to do, finance versus operations versus entrepreneurship, and how do I even think about that? Did I to make the right choice around what to do this summer? If I do the wrong internship, am I going to then set myself up for the wrong career? All those sorts of things, right? And then even, oh wait, but I think I might want to do nonprofit, but then how am I going to like make enough money if everyone else is taking the really high paying job? Am I setting myself up for failure by doing something that's more in the social sector? So again, I think all these things that I'm talking about are very common stressors that I've seen at all levels, from even people who are younger in the MBA program all the way through people who are going back and getting like an executive MBA, all kind of parts of the country. These are the very universal threads that kind of keep coming up. And I think these are all typical things to be worried about. What might be surprising is that I think maybe it's something that, despite being quite successful and ambitious, that there is still those same insecurities around: am I successful enough? Am I and the imposter syndrome sort of thing. I think that you might think from afar, or looking at someone, that they have it all together, they know exactly what they're doing, and that again, for many people, that is not the case. And again, I just think that normalizing it, that it's good to be asking these questions, because you want to be asking these questions and giving yourself the time and space to have great conversations with professors and other students and great speakers who come to campus and things like that. Like, these are the beautiful opportunities of doing an MBA. So it's okay to not have these answers. When I think about the MBA lifestyle, and both actually the different things that come up in terms of the topics that one might be stressed about, as well as the MBA lifestyle and the way that people want to be able to engage in getting in dealing with these issues, I actually think that what we have is very, very conducive to that. Specifically, everything from career, understanding your career and figuring out how do you want to think about your career, all the way through relationships, through depressed, stress, anxiety, understanding your feelings. All these sorts of topics are things that we have services for, as well as being able to do it on your own time, right? Like, you're very busy, being able to kind of go through and bookmark and and get access in the way that you need to. So I think that's one thing that's like really, really important and helpful. Also, just the cost, like people are, when you're in school, you're quite mindful of budget, and being able to have access to resources that are very affordable, I think is really, really important. And for us, just entire annual membership is less than the price of a one-on-one therapy appointment. So I think that that's really important when you're in school, is being able to feel like you can, get the help that you need in a affordable, convenient way. So I'll throw that out there, first of all, as something, to get to people. In addition to that, I do think that the first thing I would say to anyone is, you can create those resources by having those discussions. And, whether you're still like in a remote world or in person, finding a few people, talking about your own stressors, and forming, kind of small communities, small groups, to talk about these sorts of things. Thinking about like MBA Chic and the different ways in which you've engaged, right? Everything from having Instagram through having different like events and discussions, all those sorts of the various forms of having these kind of these tools. I think that kind of is similar. Do you want to go to a class and learn something? Do you want to collect information? Like, I think all of those, kind of depending on how you learn, it's like personalizing it to you. And then, yeah, I do have a number of exercises, tips, and tactics, I would say. Let me just start with a few, the ones that I think are kind of the most universal. So what I would say, like the top three, I think, that are probably the most important: sleep, mindfulness, meditation, and exercise. Those are the top three for everyone, I'm going to say. But let's start with sleep. We recommend getting 7 to 8 hours of sleep. What we know is that for most working professionals in the United States, that over a third do not get that much. Usually they're getting like less than 6 hours of sleep. And this can be, difficulty falling asleep, staying asleep, or waking up early. And so it's really important. Sleep is just that fundamental thing where when you are able to get good rest, everything else, it builds, sleep is the foundation, right? So everything else in your life builds upon good sleep. I think that there's this unhealthy thing of almost this like badge of honor that sometimes people think, oh, I haven't slept. Like, and then, in a hyper competitive environment, there's almost this sense of pride that people sometimes take around not sleeping. And that needs to absolutely just go away. So it's completely wrong. Your brain needs sleep to recharge and get better. So anything you can do to sleep better, a few tips there. One is around the term sleep hygiene, which is how do you create a better sleep environment and have better behaviors around your sleep? Things like turning your phone off 30 minutes before going to bed, right? So not like, checking Instagram or doom scrolling in those like few minutes before you're going to bed. Keeping the temperature in your room cool in like the 60s or high 70s. Using earplugs or an eye mask to block out sound and light. All these things that create a more peaceful environment ultimately help you both fall asleep and stay asleep better. Beyond that, there are also things like taking melatonin. Melatonin is just an over-the-counter supplement that can help you fall asleep and stay asleep. And so all of these just tools that can help you sleep better. Also things like journaling, lighting a candle before going to bed, things that help you calm down or collect your thoughts, I think are really, really important. So number one is sleep. Number two is mindfulness meditation. Now, mindfulness is something that over the last 5 years or so, we just hear more and more about everywhere, right? And with mindfulness meditation, there's sort of two elements there. One is the deep breathing that comes with that. A lot of people talk about deep breathing. The second is the kind of mindfulness part. And mindfulness can mean a lot of things. For some people, it is prayer. For other people, it's listening to a guided meditation on an app like Calm or Headspace. For other people, it might be taking a walk in nature. What it looks like for any individual is different. And I think it's really just about finding what works for you, what makes you feel mindful while engaging in that deep breathing. But overall, that practice of taking a moment out and really collecting your thoughts and just kind of pausing and being one with yourself, allowing that deep breathing to happen, is really one of the most scientifically proven things we have for decreasing stress and anxiety. What I think is incredibly powerful is not only does it decrease stress and anxiety, it improves mood. It also does things like increases productivity. One of the things I think is most amazing is it actually improves or increases longevity, meaning like cells actually live longer when people do mindfulness meditation. I think that's amazing. And why it is in those top three things, because like it literally makes us live longer. That's amazing. The third thing is exercise. And we all know exercise is good, right? Like we've been taught that since we were little kids. Physical exercise helps with everything from anxiety and mood all the way through, cancer or heart disease. Like it pretty much everything out there, we know that physical exercise helps and is good for us to do. The issue though is it also feels very hard to do when you're already stressed out, when you have a million other things going on, when you're trying to get to class and everything like that, right? So I think that what's important there is finding something that works for you. Maybe you don't like the elliptical, or maybe you hate SoulCycle, right? And that's okay. Really just figuring out ways to increase the activity in your life. And it can be little spurts of things like 5 minutes here and there all adds up. Like doing, 3 5-minute blocks is the same as doing 1 50-minute block. So just finding ways, and maybe that means like you're on campus and you look for ways to just walk around more, instead of biking or instead of taking the shuttle. Maybe it means one of the things that I've been doing since the pandemic started is I always try to find one call per day, whether that's a meeting or calling a friend, that I can take while I'm walking. And that just increases the number of steps I'm taking a day. And it usually also helps make sure that I'm out in nature doing something as well. And we know that being outside and time in nature also is something that helps decrease stress. So those are the top three things I would say overall. There are two answers to this. One is if you're already concerned, that means that it's time to get help. If you had a stomach ache and it wasn't going away, how long would you take to get help? Most people would say maybe a few hours a day at max if I had stomach pain and it wasn't going away. If instead of a stomach ache, if those were symptoms of mental health, like you weren't sleeping well, you were feeling really anxious or depressed, and it wasn't getting any better, the average amount of time it takes to having those symptoms and seeking formal medical help in the United States is not a few days or a few weeks or even a few months. It's 11 years. Exactly. That is the right startled look to have on your face. And what that shows is that we are way, 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 way too late to seek help when it comes to mental health. And so that's why my first answer to that question is, if you think there's something going on, go get help for it, because what's the harm there? Right? In the sense of what getting help looks like is most likely going to your primary care doctor and explaining to them how you're struggling. And what happens there is that, you're talking to a doctor about how you're doing, and they can then give you that feedback of, are you okay? Or do we need to get help? And since we know that almost everyone gets help way, way, way too late, the reality is if you're already worried about it, maybe you're not way, way too late, but maybe you're already in those early stages. And the earlier we can get people help, the better. Because, just like for any disease or any condition, if you're seeking help in those earliest stages, that means that any treatment that we're able to put out there, you're going to just respond to much quicker and better, right? So, imagine, let's say you're overweight, right? And if we start to work on your weight when you're 1 pound overweight, over 50 pounds overweight, that's only a really, really good thing. The second answer, though, is that what I tell people to think about is, how are you compared to the clinical term we use is your baseline. But what that means is just like, what are you, when you think about like your normal self, what does that look like? And maybe that means like thinking, what were you like a year ago or 6 months ago or 5 years ago? And when you think of, your normal self, and then you think these changes that you've experienced, for example, maybe normal, like regular you is someone who would always turn in assignments on time. And what you've noticed over the last few months is that you've been late to turn in a few assignments in a row. Or you loved playing guitar and you just have no interest in playing guitar anymore. Those changes in behavior, that's when you know that something's that you need to get extra help, because you're not showing up in your life in the way that you normally would. One of the best things that has happened, in some ways, I would say like the silver lining of the pandemic from a mental health perspective, I would say, has been how we are now having these conversations around mental health and well-being that we were never having before. And I think that it's been absolutely tremendous to see that, how mental health is being talked about in the media, how employers are talking to their employees, and on campuses, the openness that people now have around talking about mental health is great. I would want to see that only continue. And this next step beyond that, though, I think we're doing a great job acknowledging that we all struggle with mental health and that it's something we need to be aware of. The next big step beyond that is, how do we actually talk about the fact that there are treatments and that we can get treatment and that we both can get better, as well as the fact that this is really like a chronic, lifelong thing to deal with. A lot of times, I think the way people conceptualize mental health is, oh, I'm struggling with something and I need to get better immediately. The reality is that, like something like diabetes that could be a chronic lifelong condition. For many people, that's what mental health will be like. For some people, mental health will be something where like you're depressed once, you maybe take medication or you do some therapy and you get better. For the majority of people, it actually will be something that is more, maybe you have it once as a teenager, maybe then it comes back again in your 30s, and then you have another episode in your 50s, let's say, right? So that lifelong thing of recognizing that it is a part of our life, that's what discussions need to look like. And so we've done a good first job of getting it out there. Now we need to go beyond that so that people see what it looks like beyond, okay, I got the diagnosis. What does life look like of struggling with mental health, getting better? How do I engage friends and family into that discussion and move forward? My favorite is gratitude. Having a gratitude practice. I actually start my day when I wake up in the morning. The first thing I do for myself is a gratitude practice. I think about the past day and think, whom or what am I grateful for? And if it's a person, I usually will text them and say, you are my gratitude for the day, and really go into details. Like, I am grateful for you because of X, Y, and Z. And what I see is that both the act of me, writing down and going into detail for myself is great, because I've been able to actually, put down in words why I'm grateful for them. But then being able to share it with them adds this whole other element of that kind of shared experience. And then I've heard from them how great it feels on their end to receive that. The reason I think gratitude is great is, we talked about exercise and mindfulness and all of the scientific evidence there around why those are so helpful. Gratitude is actually the next thing, where there's tremendous scientific evidence for gratitude, the gratitude exercise, as being really helpful in decreasing stress, improving mood, helping people feel more connected, building up resilience, and all these important elements of well-being. And literally something like just writing down a couple things that you're grateful for 2 weeks improves all these things I'm talking about. And the reason I mentioned the scientific evidence part is that, like, as a doctor, that's something that's really important to me. Is I don't want to just put something out there and say, do it. I really focus on, like, when do we actually have scientific proof that these things work? Because a lot of these things, I don't want to say hokey, but just say what I'm grateful for. Okay, sure. Right. Except that, like, we have the studies to show this really makes a difference. And moreover, it makes a difference in all these really important ways. So whenever I'm suggesting something, I think a lot about that. And I think gratitude is just amazing in that way. Another thing is being kinder to ourselves. In particular, in this hyper competitive world, it is so easy to just feel more and more stress and pressure. I think especially for women, this is something where, we have been, for most, I don't want to speak for everyone, but I think for most women, we have been socialized to always be giving of ourselves and not necessarily be thinking, what do we need first? For me, this was actually something where my biggest learning over the pandemic really was around how to take care of myself. And I think a lot of women, I've heard these same stories of a lot of women realizing that they've been giving so much to others, but not really learning how to take care of themselves. And I think a lot of that is around, being kind to oneself, talking to oneself, and treating oneself in the way that you would your best friend or someone you love and care about. And it is really hard at times, because it's not something that for a lot of women that we've grown up with, that has been rewarded historically. And it is something then that has to be something that we almost teach ourselves at a relatively later stage in life. But it's so tremendously important, not only for ourselves to take care of ourselves, but then to be able to model that for younger generations, whether you're a parent or whether you just want to, be able to show other women in your life how to show up like that.